in Thomas test?
Perfect.
So the first step is you literally inspect, because those Thomas test is used to assess fixed flexion deformity of the hip joint, which can happen due to osteonecrosis, okay, secondary to a vascular necrosis of the hip. So they will have, to mask that pathology, they will have an exaggerated lumbar lordosis. Everyone has lumbar lordosis, but they will have an exaggerated lumbar lordosis in order to mask that hip flexion deformity, fixed flexion deformity of the hip. So you first inspect laterally, see if there's a tunnel here, see if there's light passing through the lumbar area. Okay, so that's the first step you do, inspect. Here, see if there's a light, you can see light when you inspect laterally. Then what do you do? So here the patient has an AVN at the right hip. Okay, so then you make your palm, wave your palm and feel for the lumbar lordosis. So now I can feel for the lumbar lordosis. I can feel a gap at my palmar aspect of the head. So this is affected. What do? I ask the patient to flex the contralateral, the physiologically normal hip as much as he can. So I'll ask the patient to move the knee towards his chest. Okay. So when the patient, this is the maximum flexion of the left hip which is able to do. So when the patient flexes the normal hip, I can feel the obliteration of the lumbar spine. Means the lumbar lordosis is lost. So when I obliterate the lumbar lordosis, the affected hip, the fixed flexion deformity of the affected hip will surface. So I can see the affected hip. So someone measured the fixed flexion deformity of the hip. So this is the angle of the fixed flexion deformity of the hip. So it surfaces. Now I can see the true deformity here. So the angle will be between the couch, the bed, and the posterior part of the thigh. So that's the angle which I take. Okay, 35 degrees. So it's a 35 degree of fixed flexion deformity of the hip. Okay. And so what will happen? What will happen if I attempt to extend the hip? So when I attempt to extend the hip, I will feel the lumbar lordosis resurface. I can feel the exaggerated lumbar lordosis here. I can feel the pressure getting off my arm. Okay, and in another case, what if the patient has a fixed flexion deformity of the knee? Let's say I want to do a Thomas test, but he already has a fixed flexion deformity of the knee joint. Let's say the knee is already flexed like this permanently. So if I'm putting him flat on the bed, flexion of the knee will inevitably cause the flexion of the hip. So I won't be able to do the test. So what do? I will push his going sideways to the bed, end of the bed, so that his knee joint hangs freely. So whether the knee has a fixed flexion deformity or not, it doesn't matter. I can still do the examination. So this is what I will do. So let's say he has a fixed flexion deformity of the hip. So I will just let it hang like this. In case he has a fixed flexion deformity of the knee joint, then I will do the same Thomas test. I will flex the normal hip, and this way it will flex on it.